Hello, Mr. Salim. I'm Dr. Sindhu, one of attending doctor today. Um, may I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. Mm-hmm. Is there anything else you want to add? Mm-hmm. I'm very sorry to hear about that, Mr. Salim, and I understand that how difficult situation would be for you. But to better understand your condition, I need to ask you a few questions. Is it okay with you? Thanks for your cooperation, Mr. Salim. So, can you tell me um, uh, what you understand from vertigo? Mm-hmm. Okay. Can you describe your symptoms, Mr. Salim? Okay. All right, Mr. Salim. So, um, as you stated that spinning, if you are spinning, you have noticed that surroundings are spinning. Surroundings are spinning. Mm-hmm. Okay. And how often do you get it? Mm-hmm. With every time of posture? May I know the duration of dizziness? Mm-hmm. Few seconds. Uh-huh. Okay. If there is any associated symptom with that, have you noticed any nausea, vomiting, deafness? Mm-hmm. Have you noticed any ringing in the ears? Mm-hmm. All right, Mr. Salim. So, if you had any recent viral flu, mm-hmm. Okay, and if there was ear pain along with that, mm-hmm. Okay, do you feel dizziness when you suddenly stand up, turning head, looking up or down? All right, Mr. Salim, did you recently hit your head in an accident? If you had any head injury? Mm-hmm. All right, Mr. Salim, have you noticed that you get dizzy when you skip meal or take excessive exercise? No? Okay. Have you noticed any neck pain and stiffness along with that? Mm-hmm. All right, Mr. Salim, to better understand, I need to ask you a few personal questions. Is it okay with you? Thanks for your cooperation, Mr. Salim. So, Mr. Salim, do you smoke? Mm-hmm. How much cigarette per day? Have you ever tried to quit this habit? Mm-hmm. I really appreciate it. We'll talk in detail in next appointment. How it sounds to you, Mr. Salim? Mm-hmm. Okay, Mr. Salim, do you drink alcohol? Mm-hmm. Okay. And do you suddenly get dizzy and fall? Mm-hmm. Have you noticed and you have um, difficulty working? It is difficult to maintain your balance. Mm-hmm. All right, Mr. Salim. Are you kind of nervous person? Mm-hmm. Right. What do you do for living, Mr. Salim? Mm-hmm. Okay. Okay. So, have you noticed any triggers that makes your symptoms worse? Mm-hmm. Okay. Do you have history of headache, half-sided headache, migraine, and ear problem? Mm-hmm. Do you, if do you have high blood pressure, high blood sugar? Mm-hmm. All right, Mr. Salim, if you're taking any medication prescribed by doctor or over the counter. Mm-hmm. Have you noticed that you're about to fall when you are emotional? Mm-hmm. Okay. After maturation? No. Okay. Mm-hmm. All right, Mr. Salim. So, in order to better understand, I need to examine you. Is it okay with you? Thanks for your cooperation, Mr. Salim. So, can you please work for me with your heels? Now, with your toes. Mm-hmm. Okay. Um, and could you please come on the couch? Mm-hmm. Then I'll check pulse and blood pressure while sitting and standing, and then I'll check cranial nerves. Okay, Mr. Salim, I'm going to make H in front of you, okay? And let me know that if you can see my index finger, okay? And if you feel a dizziness, let me know. I'll stop there, okay? And okay, Mr. Salim, please open your mouth and say ah. Mm-hmm. Okay. All right, Mr. Salim, I'm going to press your left ear, okay? And I'll whisper near your right ear, okay? And repeat after me what I whispered in your right ear. Is it clear to you? Mm-hmm. Okay. Repeat it, Mr. Salim. What did I say? Mm-hmm. Okay. Okay, Mr. Salim, can you please stand up and with your straight arms and join your feet, okay, and close your eyes. You need not to be worried. I'm here to hold you, okay. Mm-hmm. Okay, and then I'm going to check your reflexes, okay. Then I'll check knee reflex and ankle reflex. Mr. Salim, could you please touch your nose with your index finger, then touch your index finger with my finger. Okay. Yes. All right, Mr. Salim, could you please clear palmar and dorsal at your opposite hand, on your opposite hand? Mm-hmm. Okay. All right, Mr. Salim, I'm going to auscultate and carotid berry. So, Mr. Salim, take deep breath, please. And then I'll listen and with the bell of a stethoscope. And then I'll check heart murmurs at aortic, pulmonary, tricuspid, and mitral area. And okay, Mr. Salim, please come on the couch. Okay, and turn your head on the right side. Okay, and I'll hold your head. Okay, and I'll keep it down the couch. Okay, and then I'll check your eyes. Okay. Okay, then I'll do Hallpike maneuver, and then I'll hold his head for 10 seconds and to see if there is any nystagmus. All right, Mr. Salim, and you can have your seat. Okay. So, Mr. Salim, have you undergone any investigation so far? Mm-hmm. Okay. Okay. How it sounds to you if I offer a few labs? Mm-hmm. Okay, Mr. Salim. So here is a urine for glucose. Okay, and full blood count. Okay, and an ECG. Okay, is everything clear till now? Mm-hmm. Right, Mr. Salim. So what I have gathered from you the history you have shared and question I have asked and examination I have performed. I came to the conclusion that most probably you are having a condition what we call in American terminology is benign proximal postural vertigo. Okay, as you stated, it lasts for a few seconds. Okay, and so recurrent attacks of sudden onset vertigo lasting for a few seconds or minutes occur due to sudden change in posture, common okay in this condition. Okay, and as you stated that you had viral infection. Okay, so it is associated with that. Okay, and examination I performed, it confirmed. Okay, so you need not to be worried, Mr. Salim. Okay, it occurs only for a few seconds or minutes. Okay, and let me reassure you that usually it is self-limiting. Limiting. Okay, it resolves in few weeks. Okay, although may continue intermittently for years. Okay, but let me reassure you. Okay, that it will resolve by its own. Okay, and I'll encourage you to minimize the symptoms by sitting and lying in stages. Okay, and try to maintain trigger position if it makes sense to you, Mr. Salim. Mm-hmm. Okay, Mr. Salim, and I am going to um, prescribe tablet meclizine. Okay, you have to take it for 25 mg 3 times a day for 3 days. Okay, um, and then for maintenance, 25 mg once a day. Okay, after 3 days. Okay, and do not stop or adjust without consulting me, if it makes sense to you, Mr. Salim. Mm-hmm. Yes, Mr. Salim, and I hope that it will resolve. Um, okay, within 2 weeks or a few weeks. Okay, and or to be on safer side, I am going to refer you to the ENT specialist. Okay, maybe he'll advise you please maneuver. Okay, it is a technique. Okay, they will teach a specific technique that involves a series of head and body movements. Okay, if it makes sense to you. Mm-hmm. All right, Mr. Salim. And along with that, I'll for you to vestibular rehabilitation therapist as well. Okay, is it convenient for you? Mm-hmm. Okay, Mr. Salim, if there is anything else you want to discuss with me today. Okay, Mr. Salim, I wish you a healthy and happy life. Here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Take care. Bye-bye.